Image Quality by Rachel, Krista, Brittany, and Valencia.
Contrast can be described as the difference between adjacent densities. It is primarily controlled by the KVP used in techniques. Contrast makes it easier to distinguish edges of interest or abnormalities from the surrounding area. For example, let's look at the painting. You can see the difference in density and shades of gray from the outer border to the inner border of the flower. And when you look closer to the center, you can see the image as enhanced contrast with more of a visible image. The greater the contrast resolution, the more visible the image. How are we able to determine between an optimal image, underexposed or overexposed film? Simply by using the D-log-E curve created by two photographers, Herder and Driffield, in 1890. The D-log-E curve is a graphic relationship between the amount of exposure and resultant density. There are 5 important components within the curve: base plus fog, toe, straight line portion, shoulder, and Dmax. We are more concerned with the straight line portion between the toe and shoulder because this is when the film is reacting to the exposure. This is also considered the optimal diagnostic range of exposure. Anything that is below or higher than this point can change the contrast of an image by producing underexposed or overexposed images. Densities below the toe will be white, above the shoulder will be black. It is a slope that determines if the line between grays are low or high contrast. Now that we have a better idea, let's take a better look of how contrast affects an image by looking at these 3 paintings of the moon. Image A has high contrast, few shades of gray, low KVP technique, and the difference between densities is great. Image B in the center has low contrast, more shades of gray, and high KVP technique, and difference between densities is minimal. Image C is the optimal image, has the right amount of contrast, KVP technique, shades of gray, and most importantly, visible detail. In digital imaging, images undergo post-processing by using the histogram and lookup table. The histogram identifies all intensities on the imaging plate in the form of a graph, on which the x-axis is the amount of exposure read and the y-axis is the number of pixels for each exposure. The graphic representation appears as patterns of peaks and valleys that varies for each body part. The raw data used to form the histogram are compared with a normal histogram of the same body part by the computer. This is when the image correction rescaling takes place. The values displayed at the far left represent the number of intensities of black, and as the tones vary toward the right, they become brighter. The middle represents medium tones. It is very important to know the shape of the histogram is anatomy specific. Taking an exposure and selecting the wrong anatomy could appear overexposed or underexposed. For example, take a look at the histogram of a chest compared to a shoulder. You can already see the differences between the varying tones and shift of the histogram. Since KVP is the primary controlling factor, the higher the KVP, the narrower the latitude appears on a chest histogram. The lower the KVP, the wider the histogram appears in a shoulder X-ray. When we talk about manipulating contrast on a displayed screen, we are adjusting the contrast and brightness of the image. We are able to manipulate the contrast of the image by controlling the window width and the brightness of the image displayed by window leveling. For example, take a look at the image of the AP scoliosis. The optimal image is to the far right with a window level at 200 and a window width at 3.01. When we decrease each of these factors by 50 from its original value, the image becomes less bright due to window leveling and a higher contrast due to window width. The overall image appears more black and white. Now, let's take a look at the image when we increase the original value by a factor of 50 from its original window leveling at 200 and a window width at 3.01. The optimal image is to the far left with window leveling at 200 and a window width at 3.01. When we increase each of these factors by 50, you can visually see a change in contrast and brightness. The brightness of the image decreases and the contrast decreases, causing the image to have a lower contrast. An overall grayness appears compared to the previous slide when we decrease the factors by 50. The lookup table is applied after the histogram and controls the luminance values derived during image acquisition. The purpose of the lookup table is to evaluate the raw information and correct or integrate it into the correct luminance values. This takes place by changing the gray values from the raw image into a new image. The end result for the image is an appropriate density and contrast image. For example, take a look at the model. The raw image is with her without any makeup, and by applying makeup to the raw face, we are changing the values of her face. Then results is an optimal appearance.
Detail is the degree of geometric sharpness or accuracy of structural lines actually recorded in the image. It is one of the easiest factors to evaluate and adjust. There are 5 main factors affecting recorded detail: object to image receptor distance, source to image receptor distance, focal spot size, intensifying screen, phosphor size, and concentration and motion. The geometry of the beam is the most important factor in achieving the level of resolution and detail desired. The X-ray beam is emitted from a small focal spot, and photons diverge as they move further from the source. This is known as the inverse square law. Another aspect of beam geometry is distance. Resolution is improved with greater SID. An image may appear blurry, but taking a few steps back and reviewing it from further away greatly improves the sharpness and detail. Resolution is also improved with less OID. This is why the side of interest is always positioned closest to the IR. Film screen and CR imaging both use a phosphor to acquire images. As the size of the phosphor and thickness of the phosphor layer decreases, resolution increases and patient dose increases. Higher phosphor concentration results in a better resolution and lower patient dose. The quantity of photons reaching the IR affects detail. Insufficient photons will result in a blotchy mottled image called quantum mottle. This can be corrected by increasing that mass. The image processing system also limits recorded detail or spatial resolution. Spatial resolution is determined by the matrix size, pixel size, and grayscale bit depth. Increasing the size of the matrix increases the size of the pixels. This creates an image with much more visible detail. High grayscale bit depth of shades of gray also improves the spatial resolution. Motion is a final factor affecting detail. Motion during exposure will cause a blurry image. Voluntary motion is controlled by the patient. It can be prevented by effectively communicating instructions to the patient or by using means to immobilize them if necessary.
What is density? Density is the overall darkness of the film. What impacts density IR exposure? Attenuation, quantity of matter per unit, volume per cubic meter, thickness of absorbing material, inverse relationship, how tightly atoms of a substance are packed together, filtration, beam restriction, collimation, reducing field size, contrast media, inverse relationship, and pathology. How tightly atoms of a substance are packed together, quantity of matter per unit, volume per cubic feet, how much of a particular substance is in a given area, thickness of absorbing material, and attenuation. Attenuation. Bone tissue is denser than lung tissue. Pathology impacts density. Density of atomic number affects attenuation. The photons making their through matter to reach the image receptor decrease focal spot size, tight collimation, and reducing field size, increase detail. Focus the photons to area of interest and increase good image density. Scatter of radiation has a visible effect on density. The greater the part of interest being imaged, the more scatter will be produced. The further away the source of the radiation, the greater the field of scatter.
What is distortion? This is the misrepresentation of the atomical part by size or shape. There are 2 factors that affect distortion: size distortion and shape distortion. Size distortion includes OID. OID stands for object to image receptor distance. Object is magnified as OID increases, critical in both magnification and resolution. When objects within a structure are at different levels, they will be projected onto the image as different sizes. Size distortion also includes SID. SID stands for source to image receptor. The major effect is magnification. The greater the SID, the smaller the magnification, because as SID increases, the percentage of the total distance that makes up OID decreases. SID ranges from 40 to 72 inches. This must be determined by the radiographer during positioning. How to calculate size distortion. Magnification or size distortion can be determined by calculating the magnification factor. This is M equals SID over SOD. Shape distortion can be described as either elongation or foreshortening. Elongation makes the object longer than it appears. Elongation happens when the tube or the image receptor is improperly aligned. Foreshortening is when an object is shorter than it appears. Foreshortening occurs when the part is improperly aligned. This image shows that these teeth are a lot shorter than they're supposed to be. There are a few things that can cause shape distortion. Structures lie normally at different levels within the body, divergence of the X-ray beam, and alignment. Alignment can be off either with the central ray, atomical part, or image receptor. When the central ray is not perpendicular, this results in some shape distortion. The further the central ray, the greater the distortion. The anatomical part must be positioned perpendicular to the central ray and parallel to the image receptor. If the image receptor is not parallel to the object, or if the central ray is not centered to the part, this will cause shape distortion.